And now, all of our aching backs. Back pain, the second most frequent reason for a visit to the doctor in the United States. And Americans spend more than $26 billion a year searching for relief. In fact, dealing with back pain has become a bit like treating the common cold. A lot of promising options, no proven cure that will banish the all too familiar pain, but it could be about to change. Here's an alternative. For some, the sharp jab of pain comes on suddenly. For others, a deep ache, and it can last for years.
It was hellish. The hellish pain at a cane, couldn't walk around the block, couldn't go out, had trouble sleeping, and life is pretty bleak.
The culprit? Back pain.
80% of Americans will have back pain at some point in their life.
While most sufferers get over their back pain in a few weeks, 1 to 2% eventually turn to surgery, most often to fuse together the spine or remove a problem disc. But pain specialist Dr. Norman Marcus has a unique approach to back problems. He treats muscles for back pain.
There's no voice for muscles. There's no discipline in medicine that looks at primary muscle pain.
After 2 back operations to fuse his spine, Sandy Teller thought he'd have to get used to living with the pain that traveled down his leg. But after seeing Dr. Marcus, he found relief, he says, within an hour, and his pain has never come back.
This was a religious experience for me. You know, there's nothing like it. He gave me my life back. Gave me my life back, and my wife's too.
Hold it right there.
While it's never been a secret that muscles are the most common reason for back pain, Marcus feels a thorough exam of the muscles is not typically done by physicians. Instead, the doctors focus on the spine as the culprit, which is often repaired with surgery.
We're really for everything that works, and the belief is that if we would incorporate muscles into all of our approaches, including surgery, that everybody's results would get better.
But finding the offending muscle can be harder than it seems, so Marcus created a tool he calls the muscle pain detection device. It is not yet FDA approved, but Marcus says it can electrically identify a single muscle causing pain, replicating what happens when the muscle moves.
The cause of the pain is determined by the muscle that is painful with stimulation.
If a muscle is the problem, he often treats it with a simple procedure, piercing it with a needle. It softens the hardened muscle and allows for new blood to return to the area.
That muscle can restore its normal length and normal function. So we have patients who've had pain for years who are pain-free now.
While many patients call Marcus their savior, some doctors may be skeptical. Pain specialist Annette Stevens was, until she extended her fellowship to work with Marcus.
You can't disagree with the results, and it's pretty clear that if you can identify the muscle and if you inject it and follow it with therapy, that in the vast majority of patients they get pain relief.
I think if more physicians would begin to look at muscles and begin to make these diagnoses and consider treatment for primary muscle pain, we would see a huge benefit in our patient population.